The team had asked us to talk about some of our COVID-19 vaccine work. This topic came up recently because another junior investigator reached out about flu vaccine hesitancy. And, and this brought up sort of the idea of the fact that we had done this project around the pandemic. But we think a lot of the lessons learned from this project could be applied to other things like flu vaccine hesitancy. And so I think it's still relevant, even though the pandemic seems like so long ago. So hopefully you guys all find this to be relevant too. We've given this talk several times, so apologies if you've heard this before. But given that we only have 5 minutes, we're going to keep this super high level, talk a little bit over the slides that we have. So if you have questions at the end, we're happy to answer questions or talk offline. We have no conflicts of interest, and this research was supported by 2 grants from ACEL. So they had a COVID-19 Rapid Science Grants Program, which was a pilot grants program during the pandemic. And then we also applied for administrative supplement specifically to address COVID-19 vaccine hesitancy. The first grant that we actually got was actually looking at something completely different. It was around understanding disparities in COVID-19 outcomes around multiple domains. But then the vaccine became available, and so we quickly pivoted to also try and understand parent beliefs about the COVID-19 vaccine for their kids. Really briefly, and I put the reference here for our article about this if you're interested, but we surveyed 49 caregivers of children at Nemours of diverse backgrounds. And you can see here, we asked about intention to vaccinate their children against COVID-19. And about a third of parents were unsure if they would vaccinate their children against COVID-19 at that time. Again, this was right before the vaccines came out. And we saw higher uncertainty rates among parents of Black children. We also asked questions about COVID-19 beliefs guided by the health belief model. And there were clear disparities here too. And you can see those here. So in particular, parents from communities of color and communities with fewer opportunities were less likely to believe that the vaccine was effective and safe. And parents from rural communities were less likely to believe that COVID-19 would cause serious illness. And finally, parents of younger kids were less likely to believe many things, including that their child would get COVID-19, that it would cause serious illness, and that the vaccine was safe for their child. Finally, we asked about cues to action. So that's part of the health belief model. And by far, health experts and doctors were the people who parents thought would affect their decision to vaccinate their child against COVID-19. So all of this together showed us that we really needed to do work to educate, but also to motivate parents to vaccinate their children against COVID-19, and that we really needed to tailor any intervention to the beliefs of the community and also leverage trusted messengers. I'm going to pass it on to Paul.
All right. So because we wanted to make sure that we were trying to reduce disparities and promote equitable uptake of the COVID-19 vaccine, we wanted to make sure that we were incorporating the voices of the communities that we were trying to serve into the research process. So at the outset of one of our projects, we had engaged with some people within Nemours and also some trusted partners in the community, including friends over Christiana, to try and identify different partners across Delaware who we should engage throughout the research process. I'm not going to kind of go through all of these groups individually, but we wanted to make sure that we included partners from the community, including the communities of who are historically underserved within Delaware. Also our healthcare partners, because we know that they're important to actually getting the vaccines and to actually administering them, and then continue to engage in it with an advisory committee who can help us, guide us on how to engage with our community partners throughout the process. And next slide. Thank you. So here's kind of a high level framework that we used to co-create the intervention and engage with our partners. Um, so we started just by talking about what we were trying to accomplish, got their input on kind of what our objectives were, and modified them a little bit to make sure that everyone was kind of on the same page. Then we talked a little bit about kind of what they were seeing in their communities to brainstorm intervention ideas. And then we took those and we kind of went separately and developed some prototypes for intervention. So that was things like handouts that would help educate families about the COVID-19 vaccine, topics for videos, things to educate pediatricians about how to talk to families about the vaccine. And then we brought them back to our family partners and we asked them, well, what do you guys think? Is this kind of meeting the needs of your community, or is there anything different that we should be doing? And we use that feedback to kind of iteratively develop them until everything was good to go. And this process took multiple meetings over a couple months. So it's very busy, and if anyone's interested in doing that, we're happy to talk a little bit more about kind of what that process was like and how to make it happen. Next slide. So as we were talking with our partners in the community and our healthcare partners, we received a lot of feedback, both on kind of what would work with regards to intervention and also things that we should be considering. So the broad themes were things like from the community, they wanted interventions that targeted not only parents, but also youth. At that time, a lot of youth were actually talking to their parents and saying, I want to get the vaccine for X, Y, and Z reason. And so that could be really compelling to a parent to decide to get their child vaccinated. They also wanted local families and providers. So people who are from their communities, not necessarily like an athlete or some superstar, like you might see in other ads. They wanted to make sure that any of the content was tailored, again, to what the specific concerns and motivators families had, and then just to leverage the pediatric clinics. Nemours is, I think, privileged in the fact that we're really, embedded throughout the communities, and so, utilizing that in the kind of those trusted healthcare centers. With regards to the healthcare providers side, everyone's very busy, especially during COVID. Everyone was incredibly busy, so we wanted to make sure that whatever we were doing was as unobtrusive as possible. We wanted to make sure that we could provide more consistent guidelines and educate providers because things were changing so rapidly that oftentimes there was just inconsistent knowledge about what was and was not okay. Making sure that the vaccine was routinely offered, and then just making sure that whatever we were doing was incorporated into the culture of individual practices. Next slide. So we developed kind of a 4-component intervention that we rolled out in 4 phases that Lee will talk about in the next slides. So the first was just culturally tailored fact sheets and flyers. So all of these things that are listed were concerns or motivators that our family partners said were really important. They approved the language, they approved some of the imagery, all of that great stuff. Next slide. We also had some motivational posters that included just, like that. So those are local youth at, when I'm blanking on the name of the location. Lee, do you remember?
The warehouse.
The warehouse, thank you. So it's located in Wilmington. So these are teens who attend the warehouse. We were actually fortunate that some of the leadership for the warehouse were part of our community partners, and they helped make this happen. And these were all hung up in clinic. Next slide. We also created some videos that featured local youth and providers talking about a variety of different things that occurred during the COVID-19 pandemic. Next slide. Specific to the healthcare side, we educated or created some kind of brief education around more family-centered communication strategies around the vaccine. So we created kind of do's and don'ts that providers could read very quickly, could be posted up in provider workspaces. We also shifted people, instead of asking, do you want to get the vaccine, using kind of more of like this sliding scale. So, where do you fall on this scale? How ready are you to talk to your provider about the vaccine? Um, to try and, use motivational interviewing strategies to get people more on board with actually getting vaccinated. Next slide. And then last but not least, we had an amazing team of community health workers who joined us for this project. So these are our 4 community health workers, and they were doing outreach to families before their pediatrician's appointments to try and help educate them about the vaccine and get them on board with maybe getting vaccinated. I'll turn it back. And so we developed all this stuff, and then to just make sure that everything we did was copacetic with our families, we actually went back. We recruited Hispanic, Black and Hispanic youth and caregivers of unvaccinated youth, um, and we showed them all of the intervention materials that we had developed, and we got their feedback on them. Generally, it was really positive. People really liked it. We did get some really good feedback, though, on things with the family-centered communication, specifically around how we asked families about the vaccine. So, they really did not want us saying your child is due for the vaccine, because it felt like it was something they had no choice over, but instead framing the question around, how ready are you to talk to your provider about the COVID-19 vaccine? Because that felt a little bit less like threatening, a little bit more palatable.
Right. And so once we had developed the intervention, we tested it in a cluster randomized controlled trial. We selected 2 primary care clinics in Northern Delaware and 2 in Southern Delaware to be the participating clinics for this. And our primary outcome was percent of eligible unvaccinated patients with a clinic visit who then received the COVID-19 vaccine. We implemented this in 4 phases. So each of the things that Paul just mentioned, we implemented over 4 phases. And you can see here the vaccination percentages across phases of the study. So both groups had a decline, which unfortunately we saw with the pandemic, right? That people who wanted the vaccine got it early, and then over time, people just got more hesitant and more resistant to getting the vaccine. And those were the families that we were trying to reach with this intervention. But you do see that with the intervention group, there was an increase in vaccination rates in phase 3 and sustained higher vaccination rates in phase 4, which again were when we sort of implemented things with communication in the clinic and with community health workers. And then when we looked across race and ethnicity, we saw that these effects were the same across all races and ethnicities, and especially with our Black and Hispanic families, community health workers and conversations with PCPs seem to be most effective. We continued our community health worker outreach after this fact, after this study with some additional funding, and we saw that community health worker outreach reached a larger percentage of Black and Hispanic children and children whose parents did not speak English. So I know we're a few minutes over, but I think our takeaways from this, and that you can apply to any research, whether COVID-19 or not, is that really understanding first where and why disparities exist in your patient population and the communities you serve is an important first step. So really, really working with community partners, really understanding what patients are experiencing before you develop an intervention, and then working with them to develop that intervention is really key to promoting equitable outcomes. And then lastly, promoting delivery of culturally relevant messages by trusted messengers and using shared decision-making can be really important too for behavioral interventions like ours. So that's a quick overview. Happy to provide more details or answer any questions. And these are all the people that it took to make this happen.